Can you describe the effect of diabetes on the liver of non-alcoholic patients?
Yes, very important question, and a question that's important today that just a few decades ago we didn't even have. So there's non-alcoholic fatty liver disease, and that is largely related to diabetes, which I'll explain in a moment. But the first point is we didn't used to have an epidemic of NAFLD, non-alcoholic fatty liver disease. It's related to fructose intake. This is largely the work of Richard Johnson. The Fat Switch is one of the books. He's a superb researcher and communicator, and he's really, quote, nailed the issue that many had pointed out over many years, which is that fructose doesn't fool the body, it fools the person who takes it in, that you can take in fruit sugar, fructose in whole fruit, but the processed high fructose corn syrup, the corn-derived fructose, is somehow a problem, and we even know now how it's a problem. Inside the cell, it converts to sugar, and it ends up causing too much sugar to be stuck onto proteins, raising hemoglobin A1C, along with other protein that have excess sugar, impairing immune function, and eventually causing the battery of the cell to impair or run down or lose its charge. So there's an association between diabetes and non-alcoholic fatty liver disease, but the link is actually corn-derived fructose. The answer is you're sweet enough as you are. You can have whole fruits and foods. The sugars in those are fine. But processed sugar, I recommend people stay as far away from as possible. And therefore, you can keep the blood sugar of a diabetic within 80 to 110. You can keep the liver of a diabetic or anyone today happier if it is fructose-free. And by that, I mean the added fructose that is in almost all of the crisped or processed foods or beverages today. And therefore, water is your beverage of choice, herbal teas, occasionally a good cup of coffee or a caffeinated beverage, hot chocolate. These are whole food beverages that we do recommend. What we don't recommend is adding sugar unnecessarily. Processed and isolated calories usually lose nutrients. And one of the things that diabetics need are nutrient enhancement, antioxidants, minerals from magnesium and zinc all the way to chromium and vanadium. And each of these is important in the cellular metabolism of sugar. So if you have a problem with fructose because of processed food, then you're going to have a stress on the liver that can lead to NAFLD, non-alcoholic fatty liver disease. And if you happen to be diabetic and therefore have a problem converting sugar into energy for growth, that problem will be exaggerated. So the link is indirect. The link is through processed fructose. As I said, you people are sweet enough as they are. You don't need to add sugar, in my opinion, to have a healthy life.